Chapter 25, Immobility and Associated Problems. Copyright 2023, Elsevier Inc. All rights reserved. 1. Immobility terminology. Hemiplegia paralysis on one side of the body, and paraplegia paralysis of the lower body half. Quadriplegia paralysis of trunk and all four limbs, and diplegia symmetrical paralysis in any area of the body. Copyright 2023, Elsevier Inc. All rights reserved. 2. Musculoskeletal effects. 1 of 2, inactive muscle, loss of strength, endurance, and mass muscle atrophy. Prolonged bed rest may lead to loss of half of the muscle strength. Correct positioning essential for inactive muscles and joints, loss of bone mass, lack of weight bearing, activity and muscle action, and reduces osteoblastic activity. Osteoclastic activity continues. Copyright 2023, Elsevier Inc. All rights reserved. 3. Musculoskeletal effects. 2 of 2. Tendon and ligaments require movement to maintain structure and function. Days of immobility will shorten these connective tissue structures and density increases, and results in limited flexibility and range of motion. Copyright 2023, Elsevier Inc. All rights reserved. 4. Contracture of feet. Patient with muscular dystrophy. From JOS MH Disorders of the Foot and Ankle, Vol. 1, ed. 2, Philadelphia, 1991, Saunders. Copyright 2023, Elsevier Inc. All rights reserved. 5. Cutaneous effects. Factors that promote skin breakdown, poor general circulation, or anemia, edema, inadequate subcutaneous tissue in older adults, or disabled persons. Loss of sensation, mechanical irritation, or friction, excessive moisture from perspiration or urine, inadequate personal hygiene, inadequate nutrition or hydration, trauma to the skin. Copyright 2023, Elsevier Inc. All rights reserved. 6. Cardiovascular effects. 1 of 3. Full immobilization, initially blood pools in trunk. Venous return may increase. And prolonged immobility. Venous return and cardiac output reduced. Orthostatic hypotension at change of position. Short periods of dizziness, fainting, and pallor and sweating. Rapid pulse. Copyright 2023, Elsevier Inc. All rights reserved. 7. Cardiovascular effects. 2 of 3. When patient becomes mobile after long bed rest, may take weeks for cardiovascular reflex controls to return to normal, and blood pooling, stasis, increased capillary pressure, and edema promotes thrombus formation in veins, particularly in deep leg veins, blood clotting in patients with dehydration or cancer, and may be encouraged by increased venous pressure or damage to blood vessels. Copyright 2023, Elsevier Inc. All rights reserved. 8. Cardiovascular effects. 3 of 3. Blood pooling. Stasis. Thrombi may break away with movement or massage. When pulmonary embolus. When venous stasis, hypercoagulability, and blood vessel damage increase the chance of deep vein thrombosis. Copyright 2023, Elsevier Inc. All rights reserved. Respiratory effects. And decreased metabolism. Respiration slow and shallow, and deep breathing and coughing more difficult. And drugs, sedatives, and analgesics. Depressed neuromuscular activity and respiratory control center. Increased secretions in the lungs, pneumonia. Atelectasis. Copyright 2023, Elsevier Inc. All rights reserved. 1010. Digestive system effects. Increased dietary intake. Appetite, reduced negative nitrogen imbalance, when protein deficit, when constipation caused by muscle inactivity and body position, reduced food, fiber, and fluid intake, and obesity, when prolonged immobility occurs and caloric intake exceeds energy need. Copyright 2023, Elsevier Inc. All rights reserved. 11. Urinary system effects. Stasis of urine in kidneys or bladder, and normal drainage by gravity impeded infection. Stasis of urine and calculi are predisposing factors. Renal calculi stones, and more likely in people with hypercalcemia bladder infection. Uncommon if catheters are used, increase in diuresis, resulting in dehydration. A variety of causes. Copyright 2023, Elsevier Inc., all rights reserved. Neurologic and 22. Neurologic, psychological effects, unneural effects. Continuous pressure on skin and underlying tissue will stimulate mechanoreceptors, pain receptors, and others. Spasms may occur because of nerve damage, and therefore muscle innervation may ensue. Psychological effects. Effects of pain and lack of control over the environment may cause depression and health-related problems. Copyright 2023, Elsevier Inc., all rights reserved. 13. Effects of immobility on children. Immobilize for extended period of time. Normal growth and development, often delayed contractures, and loss of muscle tone may affect hips, spine, hands and feet. Mobility returns. Catch-up growth possible. Copyright 2023, Elsevier Inc., all rights reserved. 14.